Hi, my name is Ryan, student at Nightingale College, today I'll be performing the task of subcutaneous medication injection. First thing we do is make sure we got the right supplies. We have a 1 to 3 ml syringe, a needle. This would be a 25 gauge, usually 3/8 to 5/8 inch syringe. We've got only a 1 inch, so we'll pretend it's 3/8 to 5/8 inch. We've got 2 alcohol preps, a gauze, our medication. I've got a sharps container, and I've got 2 pairs of gloves just in case. So first thing we'll do is, now we've got that, we'll verify the 6 rights of medication administration. It's right patient, right medication, right dose, right time, right route, and right documentation. We will verify with the EHR, the doctor's orders with EHR, and make sure we've got the correct dose. The dose on the medication is 10,000 units in 10 mLs. The doctor's ordered 1,000 units, so that's just gonna be 1 ml that we're gonna pull up here. We'll grab our supplies, go to the patient's room, knock on the door, enter, close the door behind us for patient privacy, introduce ourselves. Hi there, my name is Ryan, I'll be your nurse today. What's your first and last name and date of birth? And I'll check with their wristband to verify the 2 patient identifiers. All right, nice to meet you. Do you have any allergies? No? Okay, great. So I'm here today to give you a dose of heparin. We're going to be giving you 1,000 units subcutaneous injection of heparin, and what that is it's an anticoagulant that it prevents the thrombin from activating. So it's used to prevent blood clots for if there's upcoming surgery, or to prevent pulmonary embolisms or DVTs or the like that. Do you have any questions? No? Okay. So, any side effects you could have, you could be bruising, there could be irritation at the site, or any itchiness. Some adverse effects. Adverse effects are effects we don't want to happen, but can happen, so we need you to tell us immediately. So adverse effects could be hemorrhaging, bloody stool, or shortness of breath. All right, do you have any questions? Okay, great. So now I'll get my stuff together again. Also, let you know there might be a burning or irritation at this injection site. Okay, so I'll perform hand hygiene, and then I'm going to put my gloves on and make sure our supplies. We'll pull up the correct dose here. We'll pop our new cap of heparin here, and we'll clean the top with the alcohol prep and throw that away. Okay, I'm gonna get our 5/8 inch syringe. We're gonna be pulling up 1 ml of air to inject into there. So we're gonna hold it, needle up, and pull down the plunger with our right hand. Exactly 1 ml of air. And now that's dried, we're going to invert this. We're going to remove the cap, put it over here. We're going to inject it in, and then inject the 1 ml of air, invert it, and draw up 1 ml of the heparin to give subcutaneously. If there's no air bubbles, if we need to get rid of air bubbles, we would tap it and inject the air bubbles back in here. There are no air bubbles, so we'll remove that. And I'm going to do the scoop method to recap it. There we go. Recap that. Put it down in a clean surface, and I'm going to find my site for injection. The site is going to be the abdominal area. We're going to be going below the ribs and above the hip bone, and 2 inches to the side of the belly button. So now we've got our site. We're going to inspect it for any swelling. We're also going to palpate it. So we're going to palpate it for any swelling or masses. And there are none. We're going to inspect to make sure there's no infection, no bruising, anything like that. And it looks good. We've already palpated it. And if there was anything like that, we would use a different site. But it looks good, so we're going to use this one. So I'll open up my second alcohol prep. I'm gonna clean from inside to outside in circular motion, about 2 inches. And I'm gonna throw that away. We're not gonna touch that again. We're gonna let that fully dry. We're not gonna blow it or anything. I'm gonna grab my syringe. We're gonna remove the cap. And now it's completely dry. I'm going to pinch the skin around the site. We're gonna come down at a 90-degree angle, holding the syringe like a dart. So straight in, pinching the skin, and then we're going to release the skin, and we're going to hold the tip of the needle. We're going to slowly inject the medication. You remove quickly and put the gauze back over it. We're not going to rub, we're not going to massage. This is going straight in the sharps container here. And we're just going to lightly put the gauze on there, and we're going to look to make sure there's no bleeding. There is no bleeding. We're going to make sure the patient's okay and they're comfortable in a comfortable position. We're going to remove our gloves. We're going to perform hand hygiene, clean up all of our stuff, and document what we've done. And voila, we've done subcutaneous medication administration.